Um, so it's my absolute pleasure to welcome everyone here to our launch webinar to introduce to the global cardiac rehab community ICCPR's International Cardiac Rehab Registry and program certification as well. So I'd like to start by giving a special welcome to some of our volunteer leaders who've been instrumental in developing both of these initiatives. So Dr. Karam Turkadawi is the, if you can wave, she's the co-chair of the registry along with me. And Dr. Gabriella Gysi is the ICCPR secretary, but also there she is, but also the user subcommittee chair for onboarding. So if you become, which we hope, you sign on to the registry, Dr. Gysi will support you in getting started. On the program certification side, it's my pleasure to introduce and welcome, I don't think he needs an introduction, but Dr. Ashish Contractor, who's the vice chair of the International Council of Cardiovascular Prevention and Rehab, but also the vice chair of the program certification. And he was kind of the impetus behind the initiative. And Dr. Emma Thomas, who is the co-chair of the certification as well, and she's from Australia. So it's not a very suitable time for her right now, but we will be offering another webinar such as this at a better time zone for that side of the world. Whoops. So here, as you can see, there are many members who have contributed to the development of both the registry and the program certification. You can see online the members of many of those committees, but I would like to invite them now, those of you who are on, who serve on one of these committees, to just say hello in the chat. If you maybe put your country and your profession and which committee you are on, and then others might reach out and they'll kind of have a sense of what excellent representation and leadership we do have from around the globe. So indeed, here is the membership of the International Council of Cardiovascular Prevention and Rehabilitation. So for those of you who aren't familiar, ICCPR is a member of the World Heart Federation, and we have named board members from preventive cardiology associations from around the world. So you can see here we have excellent representation kind of in every corner of the planet. And then there are some countries where cardiac rehab is developing and they might not yet have a suitable preventive cardiology society. And so those members join on as friends of ICCPR, and we support them and hope that in future they'll have a full community with which they can collaborate in their home country. These members speak to the ICCPR executive and did ask for a registry to measure their outcomes, and hence this was born. So our goals for the first part of this webinar are to go over the ICRR in terms of objectives, quickly how it was developed, but a little bit more look at the protocol, just to give you a demo of what the registry looks like, and then how to join. Please enter any questions you have along the way in the chat. And then when I do go through these 15 or so slides, then we'll stop and we can answer all of your questions. After that Q&A, then I will just talk a little bit about the program certification, and we can do another Q&A at that time. Okay. So the objectives of the registry, so it's a health services registry, and we are seeking to establish the quality of cardiac rehab delivery and the effectiveness in terms of patient outcomes in low resource settings. We want to optimize care. We want to build the support of the evidence base for cardiac rehab to support advocacy efforts in all of your countries, to support policy development, and for research as well, to make sure we have the new knowledge we need. So given cardiac rehab is most needed and burgeoning in low resource settings, we're hoping the registry can support standardization and optimization as this CR delivery is building. So I won't go into a lot of detail here, but we did go through a best practice multi-step process to develop this registry. The steps that we went through will soon be available, I hope, in the WHF journal Global Heart. We submitted our minor revision recently, but as you can see here, a lot of planning went in. The governance structure, as we heard, is already set up with terms of reference. The data set was developed through a Delphi process. We've got legal agreements and legal inputs into the processes. We did usability testing, and now we have launched, and we're just so thrilled to have you on this call and for your interest in being a part. So the protocol itself is registered on clinicaltrials.gov. We do have a central ethics approval in both Toronto and Qatar, but each participating site also secures their own approval, and we do help you to do that. I'm so excited. We had an email this morning about Pakistan, a site in Pakistan just got their approval over the weekend. So in terms of the, just a couple of highlights of the protocol itself. So there's some questions that you might have. So in terms of the programs and their inclusion criteria, we're looking for programs that offer initial assessment of patients, structured exercise that could be unsupervised though, and then at least one other strategy to control risk factors. So maybe you offer tobacco cessation or stress management or medication education, for example. We are focused on phase 2 programs, so at post-acute care, and programs need to be able to enter data in English at this time. They also need to be in a low resource setting. And what we mean by that is either you're in a low or middle income country, according to the World Bank, or you're in a high income country, but are under resourced with regard to cardiac rehab. And that's in line with the definition of our colleague who's on the call today, Dr. Martin Heine. So, under development of rehab in terms of financial resources, healthcare system resources, patient and provider awareness, patient constraints such as socioeconomic status, geographic issues, et cetera. So a lot of high income countries, I would say almost most, would be considered low resource when it comes to cardiac rehab and hence be eligible to be a part of the registry. In terms of patients, we're looking for programs to enter consecutive patients as possible that have acute coronary syndrome, heart failure, and or stable coronary artery disease. So with regard to the ACS, patients can have a PCI or a coronary bypass grafting as well or not. The CAD patients may or may not have comorbid valve issues or rhythm issues. The patients obviously would have other comorbidities too, and we do capture those. But the patient would need to be able to ambulate, again, because of the structured exercise component. And we don't include high-risk primary prevention patients in the registry. So if you do treat those patients just wouldn't be put in the registry. In terms of the measures, so we, again, went through a very rigorous process to develop the final data dictionary, and I'm very thrilled that many people who participated in that Delphi process are on this call as well. And I do invite those Delphi panelists to introduce themselves as well in the chat, because that was it was a two-step, 2 calls and many surveys, and I'm very grateful for the time that people gave. But we did do a literature review. We also contacted all other cardiac rehab registries, and I'm so thrilled that they have been willing to communicate with us and work with us, and we do hope to continue that relationship. And through that process, and then our, I guess, as I told you, our Delphi process around voting on each variable, which ones might be missing, how many is appropriate to have. We don't have too many, keep it simple. So we ended up with 29 variables. Of the 29, 12 are reported by program. So as a program, you would be asked to enter 12. There are 17 that are patient reported. So where possible, we've set it up so that you can get that information directly from patients. But if you can't, then you can enter that in as a program. There are a couple of optional open-ended variables. So we did hear from sites, we were trying to keep the number of variables down, and some sites wanted, for example, blood glucose, but we know not every cardiac patient has diabetes, so we didn't include it. Or some sites they had a maintenance program and they wanted to document that. So there is opportunity for you to enter in your own additional information. There are no identifying variables, so nowhere do you put a patient's name, and this really helps with supporting you to get ethics approval without too much difficulty. I realize the ethics approval process is time consuming, but so we give you an Excel file and you can match the registry ID number and your patient so that you can find them for the follow-up assessments, and you store that securely on your own system. So we don't know the identity of your patients. These variables are assessed at multiple time points. So it's pre-program and then post-program, and that is based on the duration of your program. So you'll see that you complete a survey before you join the registry, and in that survey it asks you how long your program is. And so the registry will then be set up that if your program is 10 weeks or 8 weeks or 24 weeks, at that time, it will show yellow that it's time to enter some post-program data for your patient. If your patient doesn't complete the program, we do ask that you still try to secure that follow-up data from them where possible. And then after that, there's also an annual assessment. And then these annual assessments, we hope that you can continue as you're able through to patient unfortunate expiry. So here is what the demo looks like. So we do have a live site as well, but what I'm going to show you is dummy data so that we can play around. So let me just pull that up. So yeah, so this is the registry. Again, the demo site. So we do have a few features I'll show you as well, but just to kind of show you what it looks like. So this would be the screen that you'd have with only your patients would be there. And as I mentioned on the previous slide, when you have a post-program or annual follow-up due, the patient would turn yellow so that the record is needing to be done. But here is this where you'd add a new patient. The only two mandatory variables are year of birth and gender. So these are the other ones. We hope that you get them, but we understand if you can't, but those two are necessary. And then you come into the registry. So we give you a data dictionary. And it's a Word file, and it tells you exactly how to navigate everything. Obviously, after training, it gives you a definition for each variable, how they're measured. But also when you go in here, it will, if you hover, you get the definition of each variable. So there are about 10 registry screens, and you can navigate them through this drop-down menu. And they follow by time point. So for the pre-program, there's 4 screens. 2 of them are for the program to enter the data, and then 2 of them are for the patient to enter data. Then similarly, at the end of the program, there's 2 for programs to complete, 2 for patients. And then at the year follow-up, there's one screen for programs and 2 for patients. Okay, so this is what you can see on a typical screen. So here you're entering referral, diagnosis, etc. Here you're going to denote if it's the patient that's going to give their data, or if you will give their data for those patient reported variables, and you just navigate through like that. Okay. Just going to pull this back up. So that's the data entry interface. So as I mentioned, there's this optional patient report. And if your site approves it, if this is something that you can do, if your patients speak the English language, you can put in either a text, like a mobile phone number, or an email for the patient, and they'll get a link to the survey at each time point sent automatically. So it's just so much easier for you. So this is what the text says in the email that they would get, but I'm just going to also show you just like what the survey looks like that the patient gets. So here you can see this would be intake, right? So this is a registry pre-program. Instead of ICCPR's logo, you can have your logo here for your site, okay? And it just, yeah, you walk through, the patient kind of fills out their, and again, this is dummy data, but the patient will go through and fill out their own information, okay? So again, that just really makes it a lot faster as a program for you to be part of the registry, but you're also going to get valuable information that you can see on the patient that you might want to know, particularly at the end of their program, right? You'll be able to see how they've improved and maybe areas where they might want to continue to work on self-management. So the registry does have a few other features that we've built because, again, we want the registry to add value for you and to be really useful for you as a program. So one of the big benefits is that you can benchmark your outcomes. So with the Delphi process and when we picked the variables, the panelists also rated on outcome indicators based on those. And so there are 12 outcome indicators that you can see how you're doing and compare that to all other sites. And no other site can see your data and know how you're doing. So it's just you and ICRR. We won't, say how you're doing. It's your business. But we're here to support you. So if there are areas where you would like to work on improving quality, we have a quality improvement policy, and it's going to be implemented by Dr. Abraham Babu of India, and we'll work to support you to improve processes and provide resources to support you to do that in a confidential and supportive way. So there are 2 dashboards. They each have 6 indicators, and you compare yourself to your own site. So you'll have your data from when you first started entering, and then if you try to improve yourself, you can see in the middle how you're doing since you've changed. And then on the far right in each dashboard is every other site that's in the registry. So let's just take a look at that in a second. The second feature of 4 that you'll be interested in is a lay summary for patients. So when the patients do the post-program data, it populates a letter for them that, again, we tested out with patients, and it tells them how they've changed and how they've improved. And it tells them what areas they might want to continue to work on in terms of their knowledge, in terms of, risk factor control. And again, your site logo can go on that summary to the patients. You can also export your own data. So everything that you enter, you can easily download into an Excel file or some other software program and use it for your own purposes. If you want to access other site data, that's possible too, and you apply through the process that you can find online. And the research subcommittee will be very happy to work with you towards that. The last part that we have are data completeness reports. So you can see, has the patient entered their post-program data, or am I missing a lot of variables? And that can help you have the best quality data possible. And it will help us as a registry too, to keep us working towards having quality data so that the registry is useful to the community as possible. So let's take a look at some of these features in the registry. So can everyone see, Karam, can you see the registry? screen? Yes, great. Okay, so on the main menu here, you can see the various features. So as I mentioned, export my data. So this is where you can download a file and all your data is right there. And it follows along with the data dictionary. So quite easy for you to analyze that. It just, yeah, opens up in Excel. And again, this is not real data. I don't know what happened there, but anyways, so that's that. And then this is the dashboard where you can see your outcomes. So you can pick to just pick program completers or not completers. You can look by sex and compare differences in men and women, for example. But this is the dashboard here. So there are 6 on this page, and then if you click here, there's another 6. But just to orient you again, there are 3 bars with every outcome that you look at. So here we have patient's physical activity. And again, this is dummy data, so don't pay attention to the values, but this would be your site for your first 6 months of entering data. This would be your site after that, so that if you did try to improve yourself, you could see it. And then this would be all other sites. And again, the other sites can't see your data and it's confidential. But then you can say, hey, wow, look, I improved a lot. Like I changed my patients' number of minutes of physical activity a week from pre to post program. It really went up. We were able to increase that with changes in our program. And now we're doing better than every other site, right? So you're doing well. Those are some examples. So you've got physical activity, quality of life, diet, knowledge. So do patients know what to do when they have chest pain, for example? Knowledge, do they know how to control their lipids? And this one is medication adherence. Program-related outcomes, you can look at your program completion rates. You can look at patient change in body mass index from pre to post program, change in blood pressure, change in functional capacity with METs, tobacco use, and program adherence as well. And this one you aren't compared to other sites because all the sites have different number of sessions. So here you only compare to yourself. So those are the various features of the registry that, again, we hope will serve you well and just make it so worthwhile for you to be a part. So again, the dashboards, the summary, the export my data, and then the completeness reports as well. So say you do want to join, which we really hope, the process of joining. There is absolutely no cost for you to be a part of the registry, but we also don't support you in any way in your time to enter the data or anything. So there's no cost at all around. First step to join is to complete this online survey that I mentioned. And that tells us things like who's going to be entering the data. So we have their email address to contact them. It tells us, how long your program is to set up the registry and what kind of programs features you offer at your program. Then once we receive the completed survey, our secretary, Carol Tran, who is right there, so she can, so she'll send you an email and the email will have a site agreement. So that just talks about policies around privacy and security that you would get your institution to look at. I understand that policies around ethics and privacy are different in every country. So if you need any changes to that, we expect that. So please just email us and we'll talk about it and revise it to make sure that your legislation is met. And we'll also give you the ethics documents. So the patient consent form, the data dictionary, the protocol, we can give you our ethics approval. We can give you our ethics applications, whatever you need to help you. And then when you get questions back from the ethics board, we're happy to help you with answering those as well. Once we have the approval, so the ethics approval and the site agreement, we will, Dr. Gabriella Gysi will have an onboarding web call with you and the people that are entering the data. Will be entering the data. We'll give you your own login to the live site. and we'll watch you and we'll show you how to enter a patient with the pre-programmed data and answer questions that you might have. And then you're off on to go, right? And we're here to help. But then we'll have a second follow-up call with you when you're going to start entering the post-program data. And again, we can check in how things are going and what supports that we can provide you. So just before I move to the Q&A, I just wanted to reiterate to you the benefits of joining that we've built in. So again, we have these dashboards where you can benchmark your outcomes compared to other programs. So there's 12 indicators. And as I mentioned, we have quality improvement supports to help you to improve quality where you would like to. And we want to recognize programs that are high quality through an annual report. Secondly, you get a lay summary for patients, which I forgot to show you, but I'll show you during the Q&A. Third, you can export your own data. There is certification if you're interested, and we'll talk about in a moment. And then fifth is research involvement. So every site that contributes data that has an academic, where there's an academic appointment, you would be recognized as an ICRR collaborator on every publication that stems from the registry. You also have the opportunity to kind of get first dibs on access to the data as somebody who's contributed data or who serves on an ICRR committee. And there's a full data access and dissemination policy on ICRR's website that you can learn all about that. So we do understand that there will be some challenges, and so we've been thinking about that along the way. So first of all will be the time that it takes to enter data. So we wonder whether you can have, if you have admin people that can help with the program variables to be entered. Again, try to use this patient direct report if the patients have English proficiency and a device, or you can give them a device. Secondly, a second challenge of 3 would be language. So at this point, it's available in English, but we are translating the patient materials. So everything that goes to patients, we've started translating it. And Dr. Gysi has already translated to Portuguese all of the materials. So the patient consent form, the patient survey items, and also the lay summary. So you can share those with patients. Other people are working right now on Hindi, Marathi, Arabic, French. So this list will just keep growing, and we'll share those with sites. Collecting data where patients are not proficient in English. So as we mentioned, we're hoping to have these and the questions in a survey form in their language for you. And then, or you can do a kind of interview style and enter in the registry as you go. The last challenge that you would have, we foresee, is collecting follow-up data in patients who aren't coming back. So again, the direct report, if the patient does sign up for that, this text or the email will go at the right time automatically. So that makes things simple. But if the patient isn't doing direct report, we have in the data dictionary suggestions on how to get every variable without having the patient come in to get it over the phone through an interview. And again, all variables except age and age and sex are not mandatory. We just try to encourage you to collect as complete data as you can. So that brings us to our Q&A portion. So if you would raise your hand or ask your question in the chat box. And while you're thinking, I'm going to just pull up that lay summary that I forgot to pull up there. So. Oops, I better not use that person. Just trying to, there. So here's this patient lay summary, as I mentioned. So it's just on the conclusion page. And I see Dr. Binish Adil has a question. I'll get that 1 second. But I'm just downloading this. It's a bit slow because we're on Zoom. But here you can see it. And again, you can have your logo right here. But yeah, it's just one page. And the numbers fill in from the data. So your quality of life was here, and it went up to this by the end of the program. Your functional ability increased from the beginning to the end. These are some areas where your knowledge needs to improve. This is how many minutes of exercise you were getting per week. This is about how much fruit and vegetables you're taking. How's your BMI, right? How's your medication adherence? So these are kind of suggestions at the end of the program, and just kind of some final notes for them. So again, that's available if you want to use it for every patient. Dr. Binish Adil. Dr. Binish, did you want to come off mute? We can't hear you. Dr. Adil. Any other questions or comments? Maybe while.
Hello.
Oh, there we go. Hello, how are you?
I'm good. Thank you for the opportunity to ask me a question. Can you hear me clearly?
Yes.
All right. So my first question is that, as you have mentioned, that for the data to be entered, you need to have a trainee for data entry, basically. So who
Yeah.
is the person who has to be trained? Like, is it same person can be trained for data entry who's being as a participant, or as in the employee who is been looking after all the process of this certification and registration, or this
Sure.
or somebody else who has to be trained for this? Like,
That's a good question. So on the website for the registry, so now I have to just get there 1 second. So on the website here, it tells you a little bit about the data. So we're calling them data stewards. So as a site, even if you're the medical director, in the survey that you complete, you'll tell us who you've decided will enter the data. So it does need to be someone who has access to the patient record. We prefer that you keep it to 1 or 2 so that the data is clean and as consistent as possible. But again, we were wondering, can you have your admin staff enter some data if you kind of already collect it? Can you get a trainee? Maybe you have a fellow or a PT trainee that could help out. But yeah, you let us know in the survey who you decide wants to do it. But in this information on the website, it talks a little bit about what you might want to consider when you're picking who your data steward will be. And then at that initial training, we basically schedule with the people who are the data stewards. So whoever you named to enter the data would be on that training call, and we send them the materials that they need. So we send them the data dictionary, we send them the login to the registry so they can look around, and so everything gets directed to them so they can get started.
thank you
Does
so
that
much.
answer your question? Yeah.
I
Okay,
have
great.
questions. Can I go ahead?
Yes, please.
My next question is, as you have mentioned, that we have the opportunity to have consent form or the patient information in our own local languages. So
Yes.
as I belong to Pakistan, so my question is how do I get my these information letters and patient information sheets in Urdu language?
In Urdu, right. So at this point, we do not have anything translated to Urdu, unfortunately. So we can give you the material, and like we could use something like DeepL or Google Translate and get it kind of at least started for you, so that it only needs to be cleaned up a little bit, so it doesn't take you much time. But if you don't have time, we could also put a call out to the ICCPR community to see if anyone would be willing to help with the translation process. But again, whenever people sign up, if their patients speak a different language, let us know what it is, and we can let you know if someone's working on it or if it's available yet, because we understand that that's, yeah, the patients can't consent if they're not informed, if it's not in their language. So I guess we're here to support you because we don't have the Urdu yet, but we would need someone to volunteer, be it your site or someone from the ICCPR community to help with that.
All right. So I might find myself, or our organization might find ourselves a person who can translate it well from English to Urdu, because we have already many persons who work in translating the questionnaires and different things like that.
Oh, great. I'm writing your name down right now. Thank you so much for that. Okay. Great. Okay, so I don't see any other questions, so I'm going to move to the other, just wait, here we go.